Bienvenue à la séance d'information lancée MTS. Welcome to CADTH's information session and the launch of our new 3-year strategic plan. My name is Suzanne McGurn, and I am the President and CEO of CADTH, the Canadian Agency for Drugs and Technology in Health. Before we begin, I'd like to share some truths with you about myself and the places where CADTH is situated. I am a settler, with many of my ancestors arriving from Ireland in what is now known as Canada in the 1700s and early 1800s. Like many other settler people, I have benefited from growing up on stolen lands. In my case, the lands of the Mohawks of the Bay of Quinte. As a guest to this land, I have a responsibility to acknowledge the lands on which I am privileged to live and work. CADTH recognizes the inherent and treaty rights of all First Nations, Inuit, and Métis people across this land. We acknowledge the harms and mistakes of the past and are committed to moving forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. CADTH staff work across the country, residing in various traditional lands. Our Ottawa offices are located on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. Our Toronto offices are located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat. We acknowledge the deep significance of these territories and are grateful to have the opportunity to work on these lands. Wherever you are listening to us from today, I encourage you to give thanks and acknowledge the Indigenous people who have lived there before you and who live there still and who continue to sustain and protect the land you call home. I ask that you continue learning about how colonialism has harmed Indigenous people and how we can make amends for our past and move forward humbly, learning by listening with an open heart. During today's event, you're going to be hearing from CADTH staff as well as distinguished guests representing patient, community, federal, provincial, territorial governments, and the drug and medical devices industries. You'll hear about CADTH's ambition to help shape future-ready health systems, and you'll learn more about key initiatives across our agency. Now, I'm honored to introduce Associate Assistant Deputy Minister of Strategic Planning Branch, Eric Belair, who will be delivering Dr. Stephen Lucas, Deputy Minister of Health, remarks. These remarks will help situate us within the context of a scientific and regulatory environment that is modernizing swiftly to meet the changing needs of Canada and drive innovation in our health systems. Please welcome Eric Belair.
Good morning, everyone. It's an honor and privilege to be speaking with you today for the launch of CADTH's new strategic plan. This plan comes at a critical juncture. It will serve to guide CADTH in the coming years as we collectively look to build a more robust, equitable, and future-ready healthcare system. Je tiens tout d'abord à reconnaître l'ACMTS pour le rôle crucial qu'elle a joué dans notre réponse collective à la pandémie. L'ACMTS a rapidement centré son travail en travaillant sans relâche à synthétiser les données probantes en évolution afin de s'assurer que les décideurs disposent des données probantes et des renseignements les plus récents. Responding to the pandemic has helped spearhead new innovative approaches to delivering care across Canada, including the rapid expansion of virtual care. The federal government has also adopted agile regulatory and procurement approaches to secure more timely access to new therapies and technologies to combat COVID-19. As we emerge from the pandemic, helping decision makers navigate its lasting impacts will be imperative. And CADTH's strategic plan outlines how the organization will be able to help. Even prior to the pandemic, we saw firsthand the growing impact and importance of health technologies in supporting the delivery of healthcare for Canadians. We have seen the introduction of novel therapies, many of which offer first-in-class treatments for debilitating conditions that have renewed our focus on the importance of value and sustainability. We also continue to see a flurry of new medical devices and other non-pharmaceutical health technologies brought to market aimed at improving health outcomes for Canadians. The rapid pace of innovation in this sector challenges decision makers who must rely on timely evidence and advice throughout a product's life cycle. CADTHs' work as pioneers in health technology assessment is recognized by the international community, and this strategic plan will position the organization well to continue to evolve to meet the changing needs of decision makers. We've also seen health technologies become increasingly complex in recent years. Technologies such as AI, gene therapies, and the increasing use of apps to deliver care to Canadians have challenged existing approaches and traditional sources of evidence used by decision makers. There is also a growing demand from decision makers to consider not only traditional sources of evidence, but also those gathered from non-clinical and real-world settings. Evidence-driven organizations such as CADTH have and will continue to play an important role in helping decision makers navigate uncertainty and evolving evidence. Ce qui est devenu évident à la suite de la pandémie, c'est que nous avons non seulement besoin de nouveaux outils, mais aussi de nouvelles perspectives pour nous aider à tirer parti de nouvelles possibilités. Le plan stratégique de l'ACMTS reconnaît ceci dans sa volonté de prévoir les besoins non seulement des décideurs, mais aussi du système de soins de santé. Et en se tournant vers l'objectif d'identifier des innovations qui seront essentielles pour permettre un système de soins de santé prêt à l'avenir. CADTH's demonstrated success convening partners will prove essential in driving transformative change to build a better, more inclusive and equitable healthcare system. CADTH's strategic plan also recognizes that it is no longer sufficient to simply keep pace with innovation, but to adopt a more systems-oriented perspective as we rethink how to support increasingly complex and interconnected technologies. In adopting a life cycle approach, CADTH recognizes that it has an important role to play in not only helping promising innovations come to market, but also supporting the implementation of new technologies in an efficient and effective manner by decision makers. I would like to congratulate CADTH and its leadership in achieving this important milestone and wish you all the best in implementing this vision over the coming years in collaboration with your partners. Thank you.
Merci and thank you, Eric. These insights were really helpful, and Health Canada has been a truly thoughtful and collaborative partner with CADTH, and together we know we are making important progress. Next, I'm honored to welcome David Agnew, the chair of the CADTH Board of Directors, who's going to speak and share a perspective from our board.
Well, thank you, Suzanne, and merci, Eric, for sharing the Deputy Minister's remarks with us. We really appreciated the perspectives on innovation, the evolution and importance of evidence, and the need for CADTH to help Canada fully harness the value of health technologies, because that's how, together, we will improve patient care and population health outcomes. Well, yes, I'm David Agnew, chair of the CADTH Board of Directors, and I'm absolutely delighted to be here on behalf of the board to talk briefly about the context behind the new strategic plan and a little bit about how it was built. Now, of course, the board ultimately approves the strategic plan, and we did take an active role in its development. I do want to thank the many individuals and organizations who made valuable and lasting contributions to this seminal document. From the outset, we wanted both the plan and the process to develop the plan to reflect the value CADTH places on collaboration, to leverage those strong relationships we have built across the health sector, whether with governments, patients, caregivers, clinicians, industry, or of course the research community. And I encourage everyone to spend some serious and focused time with this document. There's a link to it in the chat coming, because this is not a strategic plan that is going to sit on the shelf and gather dust. It's our game plan, it's our blueprint, roadmap, whatever phrase you choose, to how we build on our more than 30 years of excellence in healthcare technology assessment to help shape future-ready and sustainable health systems. And yes, it's ambition, but it's ambitious, but it's an ambition grounded in that excellent work that all of you do. And that ambition is directed at tackling some of the most important and challenging issues in our health system. You know, the plan was in many ways a product of the pandemic and the unprecedented upheaval it caused across Canadian health systems, coast to coast to coast, and at every level. In the early months of COVID-19 in July 2020, CADTH welcomed Suzanne as our new president and CEO. And with that new leadership and our then existing strategic plan due to expire while the pandemic was still raging, it seemed right to pause, to allow ourselves time to work through and make sense of those seismic shifts we were all witnessing on every dimension. Those shifts were and remain unlike anything the health sector and its decision makers had faced in such a short period of time. We saw, and in many cases continue to see, unprecedented levels of scientific innovation, evidence evolving faster than we can keep up, higher risk levels, faster regulatory approvals, but based on more uncertainty, severely strained global health supply chains, disinformation and diminished trust in institutions, and healthcare that has sadly become more politicized. Of course, some of these were evident pre-pandemic. In fact, as often has been said, COVID-19 seemed to accelerate underlying trends, fast-forwarding us into the future. But what hasn't changed is the reality that health technologies are a key driver of transformation. And what makes our job of assessing those technologies even more important is that they all come with risk and uncertainty. Let me give you a few current examples. The growing potential of artificial intelligence, AI, in clinical diagnosis and care, but without a national vision for the use of those mountains of patient data. Global collaboration and the regulation of assessment of drugs and health technologies. The arrival of complex drugs and diagnostics, along with questions of effectiveness, value, affordability, opportunity costs. And while new models of patient engagement and empowerment are emerging, patients and clinicians are rightfully demanding that we do more to tackle the health inequities that stubbornly persist and arguably worsened during the pandemic. So with all this and more swirling about as context for our planning, we embarked on a process that was open and collaborative. We gave time and space to consultation, starting internally and then branching out to funders, stakeholders, and system partners. The executive team engaged staff right from the beginning and asked for input on strengths and weaknesses and where CADTH needs to go next. The planning team held more than 70 interviews with stakeholders, some of whom are here today. It included those who could speak to equity in underserved populations, including Indigenous health. And I have to say, and again, on behalf of the entire board, we are deeply grateful to everyone who took time to talk to us. Your insights made this a better document. Now, emerging from all those conversations were two themes: enabling the future of healthcare and bringing evidence to the forefront of healthcare. And those two themes underscore the importance of CADTH embracing change, fully seizing the opportunities at our doorstep, and reinforcing our leadership in delivering evidence-informed support to decision makers. And we will work with agility and flexibility, making permanent some of the habits and muscles developed out of necessity during the pandemic. It all comes down to our purpose, so clearly articulated in the new strategic plan: powering evidence-informed drug and health technology decisions for sustainable, world-class healthcare for all. And with that, let me turn it back to Suzanne for a deeper dive into the plan.
Thank you, David. Thank you for your commitment to CADTH as our board chair, and thank you for adding the context for everyone here today. We are very grateful for the guidance and advice that has been offered by our board members throughout this process. It's been instrumental to allowing us to develop the strategy that will be presented today. As David mentioned, in the chat, you will see the context for being able to download our strategic plan from the website at www.cadth.ca. Over the next few minutes or so, I'm going to share with you the vision for CADTH that is anchored in our strengths and expertise and puts us on the path to maximizing our contribution and delivering impact on healthcare in Canada. Going to talk a bit more about the purpose-driven statement for CADTH that David has just stated, speak about 5 guiding principles that will influence everything we do, and discuss 3 strategic pillars that will be the foundation of all of our work. Before I move on, just want to flag to everyone that we will be taking questions at the end of this section, and you will note an icon in the top right-hand corner of your screen, a silhouette of an individual with a raised hand. Please feel free to include your questions and comments there, and we'll be happy to address as many of them as we can in the question period. So, David provided a bit of context about how we arrived at the strategic plan from listening to everyone, and we do appreciate the time and energy of so many that spent time with us to share their thoughts about what CADTH has done well and what they would like to see us do in the future. But before I get to the plan itself, I want to situate us a little bit more in the context by talking a bit about the environment in Canada over the last 5 to 7 years as it relates to health policy, innovation, and systems transformation. In addition to what we heard through consultations, it's influenced our thinking about CADTH and what CADTH's strategic plan should look like. With all of this in mind, let's get started. So I'm going to take us back 7 years ago to 2015. Growing an innovation ecosystem in Canada has been an economic priority for many federal, provincial, and territorial governments, and health innovation has been and remains a big part of that agenda. In 2015, the Advisory Panel on Health Innovation was formed and asked to identify the most promising areas of innovation that could improve care while controlling health spending, ensuring value for our precious healthcare dollars. The panel delivered a final report called Unleashing Excellent Healthcare for Canada. 5 areas of innovation were identified. These 5 areas of innovation, I hope you will see reflected in our plan. Patient engagement and empowerment, health system integration with workforce modernization, technological transformation via digital health and precision medicine, better value for procurement, reimbursement, and regulation, and industry as an economic driver and an innovation catalyst. So many of the things that we, as David alluded to, are things we knew before the pandemic, but are so much more visible in the era in which we find ourselves now. In addition, the report delivered specific recommendations for each area of innovation, and I want to highlight the one that implicated CADTH directly. The panel specifically recommended reorienting CADTH to better support the innovation agenda, providing real-time or near real-time advice. They saw significant opportunity for us to deliver advice around the life cycle of the products. Health products are not just assessed at the beginning. The panel also was among the first to recommend moving the Drug Safety and Effectiveness Network into CADTH, given the natural links with the work in our mandate. And you'll hear more about the fulfillment of that recommendation in the second part of today's session. And they asked us to expand beyond work focused at the introduction of technology and really look as well at practices and technologies that are no longer effective or optimal for patients, supporting a true life cycle approach to technology management. Fast forward to 2018. A review of the federally funded pan-Canadian health organizations, including CADTH, was announced to be led by Dr. Danielle Martin and Dr. PJ Foray. They were to make recommendations on how to strengthen the reach, coordination, and impact of these organizations that are called PCHOs. What an important piece of information for us to think about as we moved into our strategic plan. Again, a final report was released. It was called Fit for Purpose, Finding and Recommendations of the External Review of the Pan-Canadian Health Organization. It made many recommendations, but I would suggest they can be summarized as follows. They recommended to recast, reorient the PCHOs to make better use of our resources and to support quality, innovation, and system transformation. The report articulated that CADTH's value and clarity of purpose were apparent, but it also reflected that it's still important for us to continue to examine our role in terms of how we should situate ourselves in the future to maximize our contributions to health systems of Canada, not just now, but in the coming years. They were also the first to recommend the concept of the Canadian Drug Agency. As you can see, both reports have influenced the environment in which we find ourselves in this moment. With this context in mind, and with the insights gathered over months of discussion and consultation amid a global pandemic and an environment of almost constant upheaval, which David described so aptly, we set out to determine what the next 3 years should look like for CADTH. The strategic plan that we're sharing today not only shows what's ahead over the next 3 years, but it gives us a roadmap to get there. And it's a roadmap that's been built in collaboration with our staff here at CADTH, with governments, with industry, with clinicians, with patient groups, and health technology assessment colleagues, and so many more. At the heart, this plan has been designed to reinforce what we already do well, providing strong leadership in evidence-informed healthcare and serving as a hub of health technology assessment in Canada. But it is also meant to be more ambitious, to push us boldly into the future and put CADTH at the forefront of health technology decisions. First, our purpose statement. Our purpose statement replaces our previous mission and vision statements. Powering evidence-informed drug and health technology decisions for sustainable, world-class healthcare for all. To me, this statement conveys action, momentum, and impact. It crystallizes the unique role we play in Canada and gives you a more precise description of our ambition. But our organizational purpose is much more than a sentence in the strategic plan or on our website. This purpose will unify CADTH and become integral to the way we must operate. The purpose will serve as our North Star in times of uncertainty, guide our long-term strategy, operations, and relationships, reflect the heart of what we do and why we are trusted, motivate our staff to excel in work every day, and be the foundation of important decisions that we'll have to make going forward. Along with our new purpose statement, we have 5 new guiding principles. Until now, CADTH has communicated what we hold dear as our values. In our previous strategic plan, they were described as excellence, responsiveness, collaboration, and transparency. But through the strategic planning process, we came to see advantages to shifting to guiding principles that are more specific to how we want to work, how we want to act, and how we want to engage with each other and with stakeholders. I'm proud to say that CADTH is now guided by 5 principles: impact, agility, partnership, equity, diversity, and inclusion, and transparency. These fundamental principles that CADTH will operate under, they are more than just words, and on the screen and in the plan, you'll be able to see how they are described for clarity to ensure that they help shape our culture and in turn drive our performance and impact. Next, I'm really excited to talk to you about the 3 pillars of our strategic plan. They are the foundations of our future work: anticipate, innovate, and transform. With these pillars as our signposts, CADTH will enable future-ready healthcare, unleash the value of technology across the lifespan, and catalyze health system change. Our life cycle approach will help bring new innovations to healthcare while maximizing the value of existing technologies and creating modern, resilient, and sustainable health systems. But CADTH isn't an island, and this isn't work that can be done alone. We need to continue to engage experts, health system leaders, other pan-Canadian healthcare organizations, other health technology assessment organizations here in Canada and internationally. We will strengthen our engagements with patients, patient communities, clinicians, industry, academia, and researchers, and so many more, building on our history as a trusted partner and convener. And with this expanded focus on partnership, we can share knowledge, learn from one another, and find new opportunities and solutions to the most pressing challenges that we face. So let me get started with our first pillar: anticipate a future-ready healthcare. This is our opportunity to provide evidence, products, and services that prepare health systems across Canada for the rapid advances in technology that we heard from Eric Belair in his opening remarks. We all know the volume of drugs, devices, digital health products is exploding. Our role at CADTH is to identify and assess the most promising technologies that can truly shift healthcare and deliver the greatest impact and value to health systems, patients, and populations. We also want to see health technology assessment enable the effective entrance of new technologies, inform their ongoing use, and when appropriate, identify technologies that are no longer fit for purpose. And it's also importantly under this pillar of anticipate a future-ready healthcare that our work in reconciliation with Indigenous communities is recognized. We intend to continue listening and learning and engaging humbly with First Nations, Inuit, and Métis peoples, communities, organizations, governments, with the goal of contributing to Indigenous health and wellness. Second pillar, innovate. Unleashing the value of technology across the lifespan. This is our opportunity to lead the science and practice of evidence appraisal. As I mentioned earlier, this strategic plan is an evolution of what has come before, and this idea is truly reflected in the Innovate pillar. In 2018, CADTH began the shift to health technology management and to delivering evidence that reflected the rapid life cycle of health technologies. We will now intensify this work, looking more closely at early stage developments and real-world finding and things in between. The pandemic clearly demonstrated the evolving nature of science and research and the need to recognize the value of different types of evidence in different situations. At CADTH, real-world evidence is redefining how we use and understand evidence across technology life cycles. And CADTH will play a leadership role in shaping the pan-Canadian discussion on how to optimize RWE for drugs and health technologies. And finally, our last pillar, transform. Our opportunity to catalyze health system change. We are looking to achieve substantial impact through objective advice on complex questions regarding drugs, devices, and other health technologies affecting patient and population health outcomes and the sustainability of health systems in Canada. COVID really has shown us what is possible. We've all had a chance to glimpse the incredible potential of technologies, digital platforms, to quite honestly transform healthcare. And as you've already heard, the appetite for that change to continue is very real. But in tandem, there are economic imperatives that cannot be ignored. Post-pandemic recovery, including economic recovery, is a focus of every government and of the governments that will follow. Those recovery decisions will be difficult choices. And those same governments through the pandemic have recognized the value of making difficult decisions while being informed by the best available evidence and recognizing that evidence changes over time. And determining how exactly health systems will recover from COVID, whether it's tackling the backlogs, addressing the crisis in health human resources, helping the strained and tired systems, responding to patients who have not had access during COVID is going to be an ongoing question. For CADTH, this is a once-in-a-lifetime opportunity to show leadership, drive transformational change. But to capitalize on this opportunity, we need to act differently, make smart choices, align with system-wide priorities, expand our networks, deliver fit-for-purpose evidence, and offer more sophisticated support for the implementation of our advice and help mobilize the change that we're defining. When I reflect on this plan, I'm excited to think about what CADTH can accomplish in just 3 short years. As I'm coming up to my 2-year anniversary at CADTH, it's remarkable what I've already seen while I've been here, and that excitement of the next 3 years is palpable. Our plan builds on more than 30 years of excellence at CADTH. It reflects our understanding of the shifting health care environment and positions us to help health systems fully harness the value of health technologies to improve patient care and health and population health outcomes. Today has been a short introduction to our vision, but in the months ahead you will hear more about it. I encourage you to take up the challenge that was offered by David Agnew and spend a little bit of time with the document. It's not that long, and hopefully you'll find a lot to interest you in it. Even the most brilliant and inspiring strategic plan will fail if it isn't well executed. It's up to us, the entire team at CADTH, to determine the how of bringing this plan to life through our continued efforts with you. And it's up to us to communicate regularly about this strategy so it feels real and you can see how we are responding to the shifting needs and new expectations. I could not be more excited about the future that we'll shape together, working in a spirit of partnership and collaboration with the board, our expert and advisory committees, our funders, our decision makers, patients, patient communities, industry, academic and research communities. With that, it draws my comments to a close, and I hope that you can feel the excitement. I'm so pleased to be here today. And now I'd like to turn the podium over to a few individuals to provide a response. We've asked 4 health leaders to join us today and share their impressions of CADTH's future over the next 3 years. First off, I'm honored that Janine Lagacé, a CADTH board member for the Atlantic Provinces and the Deputy Minister of Health and Wellness in Nova Scotia, our Provincial Territorial Deputy Minister Liaison to the Council of Deputy Ministers of Health, is here to provide her impressions on the strategy. Janine, over to you.
Thank you very much, Suzanne. I am very pleased to speak here today in my role as CADTH board member, and in particular, the Provincial Territorial Deputy Minister Liaison to CADTH. It has been an absolute pleasure to be part of the CADTH board during the development of this strategic plan. As already has been highlighted, CADTH has taken a collaborative approach to ensure the ambitions they are looking to achieve over the next 3 years align with the realities of provincial and territorial governments. I can speak for Nova Scotia to say how meaningful this relationship has been and to have the opportunity to provide input into the direction of the organization. In considering the ongoing needs of health ministries across Canada, this plan aligns with the priorities we have been focused on at our Deputy Ministers of Health discussions, preparing for the future of healthcare in Canada while supporting system changes. All jurisdictions would agree that we need to future-proof the quality of patient care and the sustainability of the Canadian health system in a constantly changing world. Ahead of the curve, shaping future-ready health systems will focus the work of CADTH and support important work within and across jurisdictions as we emerge post-pandemic and look to become more patient-centered, efficient, and transformed for better outcomes. A key element to all of CADTH's work is timeliness. As Nova Scotia seeks to advance our health mandate, we have heard from system leadership, patients, and other stakeholders that decisions can take too long. How do we ensure that we make evidence-informed decisions in a timely manner? We have all demonstrated throughout the pandemic that we are able to make quick decisions and change course as evidence evolves. As CADTH advances this plan, I see a commitment in the organization to ensure timely decisions are made in all aspects of its business. This will be essential to meeting provincial and territorial future demands and needs. Speaking specifically now for my jurisdiction, the 3 strategic pillars within the plan, anticipate, innovate, and transform, and the work that flows from them will greatly support our health mandate and how we approach system transformation. With a focus on research and innovation, we are trying to be future-oriented, pushing the boundaries of new ways of doing things and never losing sight of the outcomes we are trying to achieve. We will be well served with CADTH's support and partnership under this new strategic plan. I would like to finish by speaking on an area of particular importance within the plan, the guiding principle of equity, diversity, and inclusion. CADTH has articulated a clear focus on this and will need to now track collective progress and demonstrate accountability for results. This will mean continuing our work in areas such as how we select board members that reflect the diversity of our communities. It also means challenging systems, policies, processes, and practices through an anti-racism and anti-oppression lens. We all have a part to play in this. CADTH's commitment to equity, diversity, and inclusion will involve listening to and working with communities to advance inclusive engagement approaches and cultural competency. I am very excited to be part of CADTH's journey in this important work. I look forward to discussing the strategic plan with the other Deputy Ministers of Health across Canada at an upcoming meeting, as well as continuing to witness the progress made on the ambitions outlined throughout the plan. Congratulations, CADTH, on your launch today, and thank you for the opportunity to participate in this session.
Merci, Janine, and thank you. And I just want to reflect the passion that you bring to diversity, equity, inclusion is so appreciated at the board and so welcome at CADTH. Next is someone that many of our audience may know. Marnie Paradis is the chair of CADTH's Patient and Community Advisory Committee, a group that offered critical advice and guidance as we work through the development of this plan. And I'm proud to say our plan is better because of the contributions that they have made. Marnie, over to you for your thoughts at this moment in time.
Thank you, Suzanne. And thank you, Janine, for your contribution. So I'm here today as the chair of the Patient and Community Advisory Committee, and this was established as a result of the outgoing strategic plan. The establishment of this committee was one of the initiatives identified in the plan, and it came into fruition as a result of CADTH's interest to have more high-level input from persons with extensive experience in health systems. So I've been able to see firsthand how CADTH incorporates meaningful engagement with patients and their communities into decision-making. So, and it's based on this experience that I am optimistic about this new strategic plan. So in particular, I'm drawn to the principles that will guide the assessment of evidence. I'm hopeful that equity, diversity, and inclusion encompasses the vast micro and macro populations that have historically been omitted or even harmed by healthcare decisions. I'm equally hopeful that patients and communities as partners helps reduce or even eliminates the erasure of patient voice in decision-making processes. So I'm cognizant that we're living in complex times, and this is made much more difficult with the realities presented by COVID. Thank you for your identification of that, David. It's very real, and we can feel it on a daily basis. The ability to be adaptive is critical, but so too is the necessity to be aware that certain peoples are disproportionately affected by the short and long-term consequences of systemic responses to these complexities. I consider it unacceptable that in these sophisticated times, many people are unable to obtain the drug or devices that they require. And this is why I'm so hopeful in CADTH's commitment to the principle of transparency, because only when it is very clear how and why decisions are made can gaps in healthcare accessibility be mended. So I do look forward with anticipation and with optimism and trust that CADTH will continue to build upon its foundation of patient-centered engagement. And over to you.
Thank you, Marnie, and thank you for the committee's work as well. I continue to be extraordinarily impressed with the thoughtful contribution and the depth of interest that every member of the committee provides to CADTH as they meet. Next is Nicole Decourt. Last year, Nicole assumed the role of President and CEO of Medtech Canada, the national association representing Canada's medical device industry. I'm thrilled that she was able to join us today virtually to share her perspective on CADTH's strategic planning process and our end result. Over to you, Nicole.
Thank you so much for inviting me to speak today. My name is Nicole Decourt, and I'm the President and CEO of Medtech Canada, which is the national association that represents the medical technology industry in Canada. Congratulations to the CADTH team on your new strategic plan. I think that for all of us in healthcare, the pandemic taught us a lot of important lessons. When I reflect on the new CADTH strategic plan, I've been thinking about those lessons that we've all learned. As an industry, we knew that the medical technology community needed to communicate and collaborate with health system decision makers so that we could all work together to share information and to have open dialogues that would ensure that Canada could respond accordingly. So we're happy to see the CADTH strategic plan's emphasis on engagement, which includes a deeper level of engagement and partnership. We can only improve and transform the way we do things if we are working with all the stakeholders that are impacted when decisions are made or processes are put in place. And this includes patients, clinicians, healthcare delivery organizations, governments, agencies, and the medical technology industry as well. Medtech Canada has been working with CADTH over the last number of years to increase that engagement, and we look forward to finding even better, more effective ways to work together. The pandemic also showed us that we need to transform our healthcare system. Canadian patients now face significant backlogs in medical services and surgical procedures. Technology is going to play a significant role in what we like to call pandemic proofing our healthcare system in the future and making our healthcare system more resilient so that we don't need to shut down critical services and so that we can continue to ensure that all patients have access to the healthcare services they need. We were happy to see that the CADTH strategic plan includes intensifying efforts related to horizon scanning and identifying technologies with the greatest promise to transform care and deliver value to patients in the system. We learned in the pandemic that we need to be nimble and we need to be open to new innovations and to learning in real time and improving our treatments for patients. Just look at what we've accomplished in 2 years in terms of how we treat COVID patients. Think about the difference from both the drugs and devices perspective and the role they've played in how far we've come in reducing illnesses and deaths. We need to take those lessons learned and apply them across the entire spectrum of health issues that Canadians face so that we ensure not only the best possible outcomes for patients, but we can build a more resilient healthcare system in the future. So that includes other principles in the CADTH strategic plan, such as viewing the value of a technology across its entire life cycle and collecting and evaluating real-world evidence. Again, we can only achieve this through collaboration, open dialogue, and early engagement between the medical technology industry and health technology assessment organizations like CADTH. We also realized the importance of digital health when patients could no longer see their healthcare providers in person. Things like the remote monitoring of cardiac patients or diabetes patients quickly became the standard of care and not the exception. We need to work together to capitalize on the momentum around digital health and remote monitoring. And that ties in very strongly to the new CADTH strategic plan when we think about enabling future-ready healthcare or unleashing the value of technology or being a catalyst for health system change. So congratulations again to the CADTH team for your new strategic plan. We look forward to continuing to work together to help inform evidence-based decisions that make our healthcare system better in the future. Thank you.
Thank you, Nicole. And now to round out an industry perspective and discuss the perspective of Canada's pharmaceutical industry, I'm so pleased to welcome Pamela Frelich, President and CEO of Innovative Medicines Canada. Welcome.
Thank you so much, Suzanne. And yes, I can feel the excitement in the air and the enthusiasm in your comments and those of others. Bonjour à tous et à toutes. It's just such a wonderful opportunity and to have this invitation to say a few words. I'm not sure that I have anything new to add, having listened to the previous speakers, but sometimes repetition perhaps can be a good thing. So I will center my comments on 3 themes: collaboration, future-ready and agile, and systems champion. So I would like to very much commend you, Suzanne, and of course the CADTH board for an innovative and collaborative approach to just kicking off a CADTH strategic plan. The innovative medicines and vaccines industry truly appreciates the invitation to provide remarks, and we welcome your commitment to collaboration, to partnership, and along with the transparency of your process. So thank you for that. And I as well noted the foundational commitment to DEI, diversity, equity, inclusion. Actually, I think you do DI. But we have also been very closely engaged in this world over the last couple of years. And I'd certainly welcome the opportunity for further collaboration on best practices. So that's something maybe we can discuss going forward. Future ready and agile is another theme that really jumped out for us. And we do look forward to reviewing the plan in depth in the weeks ahead. But a key theme that resonated with me right away is that concept of agility and a system that anticipates future innovations. Now, this is clearly going to require an HTA and reimbursement system that can keep pace with scientific advancement and adopt increasingly complex health innovations in the areas of rare diseases, artificial intelligence, genomics, precision medicine. I think, David, you mentioned all of these. We welcome the signal that you are up to the challenge, and we are as well. So with that common objective, it bodes well for patients who are, of course, always at the heart of everything that CADTH and IMC do. During the pandemic, we've seen the regulatory and health systems that they can be agile and responsive when they need to be. And I truly believe that we can and should be emboldened by that experience to ensure all aspects, all stages of the review system are as nimble and flexible as possible to address patient needs and promote, as we've been hearing, health system resilience. The third theme was the systems champion and addressing system challenges together. I think we're all struggling with that painful reality of a massive backlog in our systems. Patients deserve our very best efforts to address their needs swiftly, safely, effectively. And to do so, we will need collaborative assessment and reimbursement solutions that truly evolve our current models to work better for Canadians. Collectively, we're going to need to become more comfortable with uncertainty. I think David referenced this as well at a time of medicine's launch. And we're going to need to find ways to provide more timely patient access while generating real-world evidence to address that uncertainty over time. So as such, we really do commend CADTH for referencing RWE in your plan. We encourage ever more collective thought as to how CADTH recommendations can best support risk-sharing approaches. We've all been talking about RWE and outcomes-based agreements for many years. I suspect we would agree that now would be an opportune time for tangible, again, collaborative progress on this front. So again, and on behalf of all IMC members, congratulations on the visionary launch of your new strategic plan. We look forward to working with you to jointly advance its progressive objectives. Merci beaucoup.
Merci, Pamela, and thank you. And thank you to all four of our leaders who joined us today to share their perspectives on CADTH's ambition to play a central role in Canada's health technology ecosystem. Before I turn it over to the open forum and take some questions from our audience, I just want to reflect on the fact that this is not easy work. Despite all of the optimism and positive comments, it's going to take all of us working very differently together. The solutions are out there to be had. We all learned that through the pandemic, but it does take us embracing that opportunity ahead of us. And so to each and every one of you participating in the call today, wherever you sit in relation to the work we do at CADTH, we look forward to learning and working with you, whether you're here in Canada, whether it's one of our international collaborators, or someone that we've not yet heard of. If there are new ways for us to be thinking forward, we look forward to hearing from you in the future. And with that, I'm pleased to say it's time for our forum, where you have a chance to ask questions about our new strategic plan. As I mentioned earlier, please submit your questions or comments at the Q&A tab, which is in the top right-hand corner, an icon that looks like a silhouetted hand raised. And I'll do my best to work through those questions over the next short while. So maybe where we'll start off with is, is the strategic plan consistent with the overall direction of CADTH's global counterparts, such as organizations as NICE in the UK or other organizations that you work with? I guess I would start off by saying that, one of my very first events on arriving at CADTH was the launch of the NICE strategic plan. And yes, I think you would see common themes amongst our plans. It is about the fact that we all have different remits to do, but we do things better when we understand one another and take time to learn about one another. There are lots of things that we can collaborate on or work through in a principled way that will all set us up for greater success. But I do want to be realistic in talking to our international colleagues. We've also had the opportunity where in some places they are ahead of us to learn some of their guidance of lessons learned that they would give us, whether that's related to drugs for rare diseases or real world evidence. So I would like to say that I think our strategic plan is consistent. I'm sure many of the organizations who may be listening in today could be in their own strategic planning process. And so it will be interesting to see how much alignment there is as we move forward over the next 3 years. Another question that has come in from a couple of individuals relates to how will the work that we do here, and I think the questions are primarily framed in the drug space, but also allude to other technologies. How will we actually ensure that what our advice and the evidence we're able to identify does inform decisions that other people need to make, whether that's decision makers looking to introduce new procedures or new devices into health systems, or whether it's negotiation of new products through the PCPA, or adoption of things that we have yet to even imagine. And I think what I would say is that, again, we all have our own role to play. But as we've seen during the pandemic, we can all do our job better when we have better information and evidence. And so as I spoke about in the strategic plan, part of what we hope to be able to do is to be able to provide leadership in, where have been some of the barriers to moving forward. Pamela, used a couple of examples as she closed off her remarks about rare diseases or managed entry agreements. There's a lot of collective learning to be harnessed internationally about what things work and what things haven't worked. And I think CADTH has a relationship in Canada and internationally that will help us help others with those difficult decisions. But I'm not naive. There is no circumstance where everybody's desires can be answered. And I think we've seen that multiple times during the pandemic. We've had to watch trade-offs between health and economics and industry and what we knew 1 month that was different 6 months later. So it speaks to my comments about this being difficult and hard work. But I think if we're all up to the challenge to find the places that we can make meaningful difference and impact, we do have the opportunity to deliver on-the-ground change in the healthcare system, as was mentioned, with patients at the center of that, but as well to clinicians and to everyone along the path that has to make those difficult decisions. For those of you watching me, the questions are coming into me on my phone, so I apologize for having to pick up my phone. So there's a question that says, can you speak to how CADTH will be managing uncertainty in a more agile, innovative, future-facing way? I think for the first part of that is, I think that there's greater recognition and ability to call out what are uncertainties. During COVID, we've had the opportunity to watch the progress that's been made, started before the pandemic, but certainly continued through the pandemic by our regulators, about what is uncertain. What is it that we need to do to be able to answer those certainty questions? And how is it that we need to collect information? I'm sure if you've been watching any of the news articles recently, we have a huge opportunity here in Canada to differently harness the impact of the data and information that's held in so many different places. CADTH wants to be participating in those important discussions and making sure that we will be able to harness the right kind of information and data to help answer questions. If it's not at the beginning, perhaps in the mid-cycle of a product or later. It will be difficult. There's also a comment about, does CADTH take leadership in determining appropriate value of technologies, or does society? Or does it just reference the willingness to pay thresholds that payers have determined? It's a complex question, but I think the answer is what we all do collectively in the health system, what governments do, is no different than what we do as individuals. Each of us has, we each have to operate within the environment of that which we have. Probably in its simplest format, the way sometimes I talk about health technology assessment is like a consumer report. All of us, may have the opportunity to buy anything from new appliances to new cars. Those things come with safety risks, they come with health impacts, they come with environmental considerations. And each of us may make different value decisions based on that. What CADTH's job is, and what health technology assessment informs, is answering key questions that decision makers that have to make those difficult decisions want to know. It's not up to us to be able to make the decision on behalf of others, but it is up to us to help bring the best available evidence to inform their decision. There will always be circumstances where people will make different choices. We saw that before the pandemic, we saw that during the pandemic, and we continue to see that. So there is no simple answer to that question, but what CADTH aspires to do in the future is to continue to bring information that helps inform those difficult decisions. An additional question that came in on value, I think actually speaks to the comments that were made by our Deputy Minister, Janine Lagacé, and our Patient and Community Advisory Chair. How will you ensure value for everyone? And I think that's a question. Do we necessarily have all the tools and all the methods and all the science to do it yet? Probably not. But the questions that are being asked related to diversity, equity, inclusion are not unique to CADTH. They are questions that are being asked in all spheres, in academia. They are being asked as researchers. They're being asked in other countries. What I'm interested in CADTH doing and being committed to is participating and leading where possible to identify new methods and new ways of bringing those considerations to our decisions. It's just, Marnie made a comment to me in another setting that, was really instructive to me. And it was about, we might not be able to address all of those questions in all of the products, but at least be transparent about what you don't know and who might be left behind based on what we don't know at this point in time. That helps people ask different questions, do different research, and us be able to answer questions differently and better in the future. So with that, I'm not sure if we have any other questions coming in. Let me just check. Oh, apologies. Last question. Does the new strategic plan give CADTH the capacity to become the Canadian Drug Agency if it's called upon to take this role? Well, I'm going to take a path that that speaks to the fact CADTH has a lot on its plate. CADTH's strategic plan is forward-looking. Again, I can't speak for what the Canadian Drug Agency may look like in the future and what the fit may or may not be, but what I can tell you is that CADTH is committed to working with all of the partners, whether they're ones that we have now, whether it's our industry partners, some of you heard from today, the Pan-Canadian the PCPA, whether it's patient communities, whether it's new entities that will be created, whether it's additional of our colleagues that are in the Pan-Canadian healthcare organizations, or any changes that any of them may go through, any of us may go through in the next 3 years. We have a huge opportunity to do more together. Another question for me. How can CADTH play a leadership role or a real catalyst to spur increased DEI commitment in everyday health system operations when the system has often operated in silos on key issues? I think what I would encourage people to do is really take a moment and reflect on what health technology assessment is. Health technology assessment, often as, I came into working in this environment, or when I hear people talk about it, assume it's just about the clinical evidence and the cost effectiveness. And that's not what evidence appraisal is and what health technology assessment is. Health technology assessment in its fullest form takes into consideration clinicians' impact, patient impact, health system impact, equity issues, legal concerns, implementation considerations. So I think as we continue as a health technology organization to build robust assessments, whether we get there on as I said, the first time, a second time, building into those additional areas that will help us capture, what works in one circumstance may not work in others. And, we have developed over time comfort with identifying different patient populations where pharmaceutical products may work. We probably will see into the future opportunities to identify where different technologies work better. Where do they actually help address an unmet need? And we've certainly seen a lot of that during the COVID with the use of virtual technologies. Some of it is something that people want to harness and maintain, and others people want to reshape and think about what that needs to look like in the future. But I can tell you with the passion and commitment that the CADTH board has and that our senior leadership team has here at CADTH, the conversation about DEI will continue to evolve over the 3 years of the plan, and I'm certain that we will be looking at having conversations a year from now that we couldn't have imagined prior to the pandemic. And at the end of 3 years, whether we're bringing new evidence forward in the way that we appraise information, or whether it's a waves which we're calling out where the gaps are and helping point researchers, academia, and health systems to perhaps find out information, share data that will help us answer some of those difficult questions. And I think that's it. So with that, this concludes the time we have for our open forum. But for anyone who is shy or didn't want to put a question into the chat, you are welcome to submit questions to CADTH at requests@cadth.ca anytime, and we will be pleased to respond. This brings us to the end of part 1 of CADTH's information session. Please take a well-deserved break, get some fresh air, get some food, and we'll be back here again at 12:30 to begin our portfolio updates, where you'll hear a bit about what's been happening at CADTH this year and how the strategic plan is shaping the coming year of work here at CADTH. Thanks, everyone.